Today, the topic of our discussion is on urological investigations. And this sounds very broad, actually. And it's actually a broad subject if you look at it from the point of view of, individual pathologies. But we are going to stick to a broad view of the subject as it is presented in our textbooks in Bailey and Love. And I'm actually following the way it is presented in that book so that all of you will have something to follow up after the teaching. So these investigations, they can be seen in various perspectives, but I'm going to start from this perspective. That is, start from the non-invasive and go on till the invasive. Obviously, the whole subject will not be covered in today's talk because it is too long. So today I'm going to be starting from straightforward urinalysis, go over renal function tests, and if there is time, then maybe I get into the urological ultrasound. That's what I'm planning for the day. And what I'd like you to understand also is these investigations will not be detailed, comprehensive presentations, but where I saw faults in the way we handle things in our wards and in the hospitals, those are the things which I am going to outline. So let us start with urinalysis. And there are three components to this. One is, of course, the physical examination of urine, which we often neglect because in the wards, nobody really looks at what sample urine the patient has given. So that is as I'll show you, the physical examination itself gives you a lot of detail. The next thing is, if it is common at your end in your institutions, that is dipstick analysis. It is being picked up in India, but not largely there. So, but still we'll talk about dipstick analysis and then microscopic analysis, which of course is done in all the hospitals. So let's look at it one after the other. Now, that's important point that I want to bring forward to you is about the way we handle the specimen and how it is collected, etc. Let's look at specimen collection. We always say that you should give midstream urine of specimen. And the reason we say that is representative of the urine that exists in the bladder. The first part of the urination, which you may call, in case of fractionation, we call it as VB1. So the first part usually contains the urethral organisms, and the second part contains the bladder organism. Third part, if you actually take it, will likely contain the matter that is coming out from the prostate. For example, if you've done a prostatic massage, you will have to collect a third part of urine. But for most purposes, what we tell the patient is that they should give a midstream urine, the so-called clean catch specimen. Now, the important thing is, how much clean is this clean catch? I have rarely found people actually instructing the patients on how to give this clean catch specimen. In case of men, it is important for you to withdraw the foreskin, wipe away the glands with some kind of a bacterial solution, antibacterial solution. Like, say, most of the time what is available is povidone iodine. Incidentally, do not apply spirit because it really burns if you apply spirit over the glands. So don't do that mistake. So you should actually use the povidone iodine and then tell the patient that he should start the void and then neglect the first part and take the mid part of urine and collect it. This is what you tell men. What about women? Now, it's important to tell the women that they have to clean the entire vulva, separate the labia, and then void, and then collect the midstream sample. It is, I think, harder in women. Now, if you don't take care to do this properly, what you're going to get, quite often you see the reports coming contaminated, right? So the whole exercise has been wasted. And urine examination is actually a very important thing, which we often neglect. So therefore, tell the patient exactly how you want them to give the sample. Now, once you have given the sample, how do you send it? That we'll talk about it later. But let's look about this collection problems. Now, supposing the patient is on a catheter. Take, for example, this situation. Where the patient is on, I've written here intermittent catheterization. but the patient is on a catheter. Then what do we do? How do we collect the sample? Well, here it's not specific indwelling catheter. Yeah.
सर वीडियो आपकी ऑफ हो गई.
Video off हो गई.
हाँ हाँ.
Now also?
Yes sir. Off ही है अभी.
Audio is audible, but video is gone. I'm going to continue with audio if it gives me so many problems. But anyway, let's just try once again.
Yes.
तब तक हम इम्प्लांट स्टेबल नहीं कर लेते. हम तो हमारी लड़ाई इम्प्लांट दे.
What about now?
नहीं sir. Same.
Yes, is probably the next step.
Well, that's a very strange problem. But anyway, in that case, shall I carry on with
हाँ
audio?
you can continue.
I continue with the audio. I don't want to waste time. Yeah. So if there is an indwelling catheter, then how do you go about collecting the sample? Well, the way to do it is, if you've got a two-way catheter, which is normally what the patients have, if you have a two-way catheter, in that case, pivot the catheter, means you block the catheter, and then take a part of the catheter which is comfortable, apply spirit on top of it or povidone iodine, whatever you have, let it dry. Until it dries, it doesn't become sterile, that area. Let it dry, then insert a needle into it and collect the sample from there. Two-way catheter. If it's a three-way catheter, then obviously you have one option. That is, you have an additional port other than what is draining. So you can collect sample of urine from there, but again after sterilizing that area. So this is the way to take a sample from indwelling catheter. Now, supposing for whatever reason you are unable to collect the sample in any way, then you have the option of doing an intermittent catheterization. This is something which quite often can happen in children because it's very difficult. They may not have an indwelling catheter. They obviously will not listen to your instructions regarding voiding. So in such a situation, you will have to choose an intermittent catheterization and you can collect a sample. Now, there's another way in children you can collect a sample. I have drawn this picture here. You can see the pictures. Okay. Another way you can collect the sample, and that is suprapubic aspiration. What do? You paint the lower part of the abdomen, just above the symphysis pubis, feel the pubis, and then in case of children, the bladder is more abdominal than pelvic. I hope you remember that fact. So you can easily puncture just above the symphysis pubis, or if you want, you can take an ultrasound guidance and then puncture the bladder and collect the sample. The question is, should you take so much trouble? The answer is yes, because sometimes it may be very important to get this urine sample and examine the urine sample. And particularly in children, it poses a lot of difficulties. So therefore, that's necessary. And there's an issue which I've already talked about, that is fractionated urine samples, which means for some reason or the other, you want individual samples. For example, you want urethral organisms, or you want bladder urine, or like I told you earlier, prostatic massage. You have done a prostatic massage, you're suspecting prostatitis, and you want to see what is the nature of the organism. So it is at that time this fractionated collection helps. That means take the first sample, the very first sample that comes out, put it in one bottle, go for the midstream, put it in another bottle, and then the final sample along with which contains the expressed prostatic secretions, that will come out in the third sample. So these are labeled as V1, V2, and V3, or VB1, VB2, VB3. So so that's where you can send those samples so marked to your lab so that you get the information which you are looking for. There's another issue. Supposing somebody had got an ileal conduit. This is not something very unusual now. There are a considerable number of patients who have ileal conduits, and you want to collect their sample. How do you do it? Don't take it from the bag into which it is draining. You have got to put a catheter into the conduit, go as deep as it is comfortable, and collect the sample from there. So these are the